NFPRHA represents publicly funded family planning organizations, providers of choice, serving those who might otherwise lack access to care. The provider network plays a vital role in communities across the country. It provides care to millions of women and men, many of whom rely on the center where they get their family planning care as their sole source of health care. That's why we advocate for policies that strengthen the network and push back on measures that restrict anyone's access to high-quality family planning and sexual health care.
We have seen over the last 5 years reductions in Title X funding, and that has caused the closure of satellite clinic sites.
It worries me that there might be additional cuts, and if those additional cuts come, we might not be able to sustain the number of clients that we're currently seeing.
Together with our members, we engage and educate members of Congress, the Office of Population Affairs, and other federal decision makers about what's happening across the family planning provider network.
They have an ear to the ground as to what is going to resonate with the policymakers and with the Congress.
They've been an invaluable resource to our program by first inviting us to speak with our national legislators during that national meeting, but also training us, creating packets and one-pagers for us, literally transporting us and showing us how to navigate the hallways of the Capitol building.
I try to go in and talk to especially our Missouri legislators, and let them know they can come to me at any time and ask me any questions they have about family planning or Title X or reproductive health. And so, again, that's why it's so important that I have all these resources. So when I go in, I'm a credible source to them.
So not only do they keep their pulse on what's going on, they have a strategy in mind, and it makes my job easier when I'm talking to Congress or even state legislators.
To be part of a group that's advocating for something that, I really believe in is really something special.
We make sure policymakers understand that high quality and accessible family planning services are an essential component of the nation's public health safety net. We promise to continue to fight for policies that strengthen the network for the millions of people it serves each year.